The new Child and Adolescent Psychiatry unit is the first in the state that was both architecturally designed and clinically designed to provide trauma-informed care. We have a big need here in the West Baltimore community as well as all across our state. So we were seeing a lot of adolescents who were arriving in behavioral health crises to the emergency room, and we needed to make sure that if they required inpatient care, that we had a safe place to be able to treat them.
In speaking with the staff and the physicians, that really it was this notion of how do you create a space that is welcoming and not scary for kids. We kind of took that mindset of, what if this was your child? What would you want to see as a parent in this facility? I have children myself, so I tried to think about, what are the things that they're interested in? How might they find novelty in the project itself?
Making sure that we were really respecting our core values, holding to our trauma-informed programming so that patients and families, when they enter our unit, understand that they will be well cared for in a healing environment, and all of the different features that surround them will promote healing and well-being.
So there's a number of very specific design elements that we designed into the project. A lot of them are for safety. A lot of them are to create more of a healing environment for the patients, but we also want to keep in mind the staff as well. We also set up the unit into what we call on-stage and off-stage.
When a caregiver is on stage, they're fully engaged and present with the children. And that can be quite exhausting after a very long day. And so then we wanted to make sure that they had appropriate off space to be able to do documentation, make phone calls, and to really try to separate those activities. Our brains, we're not really good at multitasking. So when we are interacting with patients, we want all staff to feel well enough and have the energy to fully be present and help these children through these difficult times.
You hear a lot in the literature now about biophilic imagery is important. Scientifically proven that images of nature help in recovery and the healing of patients. That combined with natural daylight are things that we really sought to seek into the design. We worked with a local artist to commission artwork that was very specific to the unit and actually is functional in a way. We worked with the OT group, and that way we could integrate in the nature scenes, like for instance, squirrels or crabs or things that maybe are reminiscent of Maryland.
Our unit is designed with different activities and features. They'll be able to play games, interact with staff. So yes, they'll be doing a lot of difficult work of attending groups and learning coping skills, but at the same time, the new unit will enable them to be children, and that's what's most important.
You see kids running around the city all the time, trying not to step on cracks, only jumping on the black tiles when you're walking through a room. We took that notion of kind of joyful play in a regular environment and actually integrated patterns into the floor of the unit.
I'm looking forward to children and families coming onto the unit, feeling comfortable, knowing that they're going to be well cared for, and having some enjoyable time as well. There's nothing more rewarding than to see change in children and families and help them through difficult times. So this unit means that we're able to do it in a way that'll really provide them with the appropriate sense of healing and calm that'll enable them to get, I think, that'll help them heal even quicker.